Okay, Dr. RJB here, and I wanted to talk a little bit about atrial fibrillation. Atrial fibrillation is something that seems to becoming more common, and mostly because people are checking for the condition. And the atrial fibrillation condition increases your risk for things like heart attack and stroke. So that people who have this condition frequently have to be put on blood thinners to prevent them from having a stroke. The statistics say that a person with atrial fibrillation has 5 times the risk of a stroke compared to somebody who has a normal heart rhythm. Basically, there are 2 main parts of the heart, the atrium and the ventricle. Inside the atrium, which is actually kind of a pre-pump. In other words, the atrium squeezes down to fill up the ventricle, and then the ventricle squeezes down to pump the blood to the rest of the body. So this pre-pump also has a rhythm system, a group of cells that gives the heart its rhythm. So if you have a heart pulse rate of 7 beats a minute, it's because that atrial tissue is firing at 70 times a minute. If it's nice and regular, no problems. Everything works smoothly. With atrial fibrillation, it starts, firing erratically. So instead of it being 70 beats a minute, it might be as high as, say, 200 beats a minute. What tends to happen when you have a situation like that where the atrium is kind of firing like this, quivering, is not a lot of blood is being pumped by the atrium into the ventricle. So the ventricle has to use the fact that the circulation system is in a circle. So eventually when it pumps it out, it's going to come back around and in. But it's not being assisted by the atrium at that point. And blood in the atrium actually kind of stagnates. And that's the reason actually for the risk of stroke. During the time where it's really not moving in the atrium, the wall of the atrium can develop a clot. And then if that clot gets dislodged, it goes into the ventricle, and boom, it gets pushed into the brain, and you got a stroke. Atrial fibrillation is usually treated, like I said, with blood thinners. And the most common one was called Coumadin. These days they have some newer blood thinners because the Coumadin was always a nuisance. You had to take it, every day, and you had to be careful about watching your diet. Any kind of vitamin K would cause it to be ineffective. Coumadin basically blocked vitamin K, and so if you took additional vitamin K in your diet from leafy greens, you might actually disrupt the ability of Coumadin to within your blood. The new blood thinners are based on a type of the clotting system called factor V. So these are factor V inhibitors, and these are a lot easier to manage. There are no blood tests that are necessary. They can just be taken every day. You don't have to do a lot of constant checking. You don't have to worry about your diet. With Coumadin, because of how variable it can be, usually you have to have your blood checked initially every week, and then every 2 weeks. And then even if you're on it for a long period of time, you have to have your blood checked at least once a month. So the cost of Coumadin has to also include the cost of the labs. So even though the factor V inhibitors are more expensive, they don't have the blood work, and so in the long run, they are not that costly. And because they don't have all the risk involved with Coumadin, where sometimes with Coumadin you overdose on the Coumadin, or you'll underdose on the Coumadin because of different intake of vitamin K in your diet. These are much more stable and have less risk of bleeding problems. So that's the main treatment for atrial fibrillation. The newer treatment is a condition where they basically remove a part of the atrium. Usually the clots are formed in a small sac that's on the edge of the atrium. So what they do is do a surgical procedure where this portion of the atrium is removed, and it decreases the risk of blood clotting. If that surgery is done, you don't have to be on blood thinners. However, because it's an expensive operation, it may not be paid by your insurer. I guess they would rather pay the $100 a month for the blood thinner than the $10,000 for the surgery. They're playing the long game, even if it's not the best for the patient. Okay, so that's about it is. Now, there are medications that can convert atrial fibrillation back into a normal rhythm. That's something a cardiologist would have to discuss with you. There is some risk involved in doing that. In other words, you could dislodge a clot. Usually that's done with putting the people on a lot of blood thinners to try to avoid that. But once again, it's a decision that you have to discuss with the cardiologist. Okay, take care.